Since February is all about the heart, we thought it would be perfect time to talk about heart health.
So we got a heart-to-heart with an Adventist Health Castle cardiologist for some life-saving tips.
February is Heart Health Month, and no better person to talk to than an interventional cardiologist like Dr. Munir. Thank you so much for being with us. Appreciate it.
Thanks for having me back. It's great to be here.
I like the fact that you're going to give us tips in just a second, but Heart Health Month, is it that important that there's a whole month for it?
Definitely. So heart disease is one of the most common causes of chronic conditions that we have, and it's estimated that every 40 seconds someone across the United States has a heart attack. It's the leading killer of Americans.
And I know we've done this, but I'd like to remind everybody what exactly heart disease is.
So usually when we talk about heart disease, we're talking about blockages in the heart arteries, and that's something where they also call it atherosclerosis, or hardening of the arteries. And that can cause chest discomfort, tightness in the chest, sometimes can lead to heart attacks and even sudden cardiac death.
Okay, so super important, and I guess the next best question would be, how is it treated?
So we treat it if it's an acute problem. So if somebody's having crushing substernal chest pain, that's a heart attack, and they need to rush to the emergency department. We need to take them to the catheterization lab and open up their artery immediately. Time is muscle in that situation. If it's more of a stable situation, then they can talk to their primary care doctor and get a referral to the cardiologist. We might treat them with medicines. We might do certain tests like treadmill testing like you see behind us. And then we talk about dietary and lifestyle changes that they can do.
Do you have, for our viewers, and for me, I'll take these too, tips on keeping your heart healthy?
Definitely. So we want to make sure that we're not smoking. So smoking is a high risk for production of blockages in the heart arteries. We want to look at changing what we eat. So we want to increase the amount of fiber that's in our diet, and that comes from beans, legumes, fruits, vegetables, and other plant materials, decreasing the amount of animal products and processed meats and sugar-sweetened beverages that we're eating. We want to move more. So trying to get in as much movement as we can. If we can get to the gym, that's great. If not, just taking a little exercise after a little walk after we eat, that's always a great way. We also want to stress less and sleep more.
Ooh.
As much as possible.
Always easy
So
for
sleeping is a time for our bodies to recuperate, and for our mind, and it can lower our blood pressure, and reducing our stress levels can also be beneficial. And then we want to socialize. So we want to have a great community, having that support network, whether or not that's at work or at home or with friends, family, religious institutions, whatever you can do to keep that social network going.
Well, my heart should be really healthy because I socialize a lot, but I may not be doing some of the other four entirely, but I think those are great tips.
Yeah, so what we want to do is for people to say, hey, call up a friend, invite them out for a walk, bring some healthy snacks with you, bring some fruits, vegetables, some nuts with you on your walk, and now you're hitting most of those things and preventing heart disease.
That's great. Thank you so much for that. If somebody wants to know a little bit more information about how they can keep themselves healthy or just heart disease in general, where can they find more information?
So I happen to be giving a talk next on Thursday, February 13th at 6 p.m. in our Wellness Center. I'll be talking about lifestyle changes for heart health. So very appropriate timing. You can always talk to your primary care doctor and get a referral over to a cardiologist if necessary. And it's always important to get yourself checked out, blood sugar, blood pressure, and cholesterol levels checked out as regularly as possible.
We'll have that information for all of you on our website at kh12.com. Thanks, Doc.
Thanks so much.
Super important. Some things you don't even really think about and take for granted, but are very important.
Absolutely. It's the #1 killer for a reason. So this is a good time. You know, when people are thinking about it, you see all the heart-shaped chocolates and everything, but think about your own heart, too, and go talk to your doctor.
Really a good point. Yeah.
All right. And speaking of your heart, to eat or not to eat red or processed meat, this is an issue debated for a long time now, and a new study might have you putting down the steak knife. Yeah, here's why, okay? Eating just 2 servings of processed meat or unprocessed red meat each week can bring a small but significant increased risk of premature death and heart disease.
Now, according to a study published in the Journal of the American Medical Association, researchers studied long-term data on nearly 30,000 people, excuse me, and determined people who ate 2 servings of meats like bacon, sausage, or a hot dog each week had a 3 to 7% higher risk of premature death and cardiovascular disease.
Now, the percentages might sound small to you, but heart disease, as we mentioned, is the #1 killer in the U.S., and some say even a small reduction in risk can make a big difference.
The study's lead author says anyone concerned about heart health or risk for cancer and other diseases should limit their intake of red and processed meats.
You know, it's such an individual thing. You hear people say, don't do sugar, don't do this and this, and you have to check it out. But it really depends on what your own health type is and what your genetics are, too. But I've seen crazy documentaries talking about plant-based protein and stuff and how some people did go off red meat, too.
And we always tease, I love steak. Yes, it's one of my favorite S words. But we have, in my household, we have incorporated other things like plant-based and little healthier choices. But we do
Beyond Burger, Meatless Mondays. People are leaning into healthier habits.
There are some really good meatless substitute. It's great.
Right? And you know what was great? Castle. We just visited our friends over at Castle. The cafeteria there is incredible.
Yeah, I've eaten there before.
You know, so good.
It's good stuff.